Welcome to the Senior Health video. This video will talk about 7 clear body warnings and 7 silent symptoms of heart trouble. Have you ever wondered if your heart might be struggling in silence while you feel perfectly fine? Every beat of your heart keeps you alive, yet most people never realize when that rhythm begins to weaken. It does not always start with pain in the chest or a dramatic moment. Sometimes it begins with small changes that seem harmless. A bit more tired after walking the stairs, shoes feeling tighter around the ankles, a patch of yellow on the eyelid. These are the quiet messages your body sends when your heart is not working at 100%. Heart disease is the #1 cause of death in the United States, taking the lives of more than 695,000 Americans every year, according to the CDC and the American Heart Association. That means 1 in every 5 deaths could be avoided if people learn to recognize the early signs. Behind each number is a story, a family, someone who could still be here if they had listened to what their body was saying. But here is the truth. Your body always tries to warn you long before a heart attack or heart failure happens. The problem is that most people ignore those signs or mistake them for aging stress or fatigue. What if you could understand your body's language before it was too late? What if you could spot a change on your skin, your legs, or your breathing that reveals something much deeper? In this guide, you will discover 7 visible signs you can see and 7 powerful symptoms you can feel that may point to heart trouble. Each one tells a story about how your blood is flowing and how your heart is coping. Stay until the end because knowing these signs could help you protect not only your life, but also the lives of the people you love most. When it comes to your heart, awareness is the first medicine and prevention is the greatest cure. Number 1, Frank's sign. Have you ever noticed a faint diagonal line running across your earlobe? Most people see it as just another sign of aging. But this small crease called Frank's sign can be your body's silent alarm. Research has discovered that this mark often appears in people whose arteries are not delivering enough blood to the heart. It was first observed by Dr. Sanders Frank, who noticed that many of his patients with chest pain shared the same curious feature. Since then, multiple studies in the United States and Europe have shown that people with Frank's sign have a much higher risk of coronary artery disease. Doctors believe the reason lies in circulation. When arteries begin to harden or narrow, oxygen and nutrients cannot reach small areas of the body, including the skin of the earlobe. Over time, that lack of blood flow can create a crease. Picture an active man in his 40s who never misses work and feels perfectly fine. He notices that small line but laughs it off, thinking it means nothing. Months later, he suddenly collapses at home with chest pain that changes his life forever. If you notice this mark, take it seriously. It does not always mean blocked arteries, but it does mean you should check your blood pressure, cholesterol, and overall heart health. Your heart rarely shouts, it whispers. Listen before it is too late. But knowing the sign alone is not enough, because another visible change on your body may quietly reveal an even greater danger. Number 2, hair loss on the legs. At first, it may seem strange to connect the hair on your legs with your heart, yet this simple detail can reveal deep trouble inside your arteries. Many people notice their leg hair thinning or disappearing and assume it is from aging or friction from clothing. But in reality, it can be an early warning sign of peripheral artery disease, a condition where blood flow to the legs becomes dangerously poor. When your arteries clog with plaque, the oxygen and nutrients that feed the skin and hair follicles cannot reach them, causing the hair to vanish and the skin to turn smooth and shiny. The legs may also feel cold or heavy after walking short distances, and toenails may grow much slower than before. Doctors often say that blocked arteries in the legs mirror blocked arteries in the heart. The same process of atherosclerosis can affect both. Harvard researchers found that people with early leg circulation issues are far more likely to experience heart attacks within the next few years. Imagine a woman in her 60s who begins noticing her shins are bare and pale. She thinks it is nothing, but beneath the surface, her arteries are slowly narrowing. If you see these changes, ask your doctor for an ankle brachial index test. It is simple, painless, and can reveal hidden risks before disaster strikes. But understanding this clue is only the beginning, because another tiny mark near your eyes may be warning you of something even more serious. Number 3, xanthelasma. When you look in the mirror and notice soft yellow patches on your eyelids, it may seem like a small cosmetic issue. But those little spots called xanthelasma can be your body's early message about cholesterol trouble and heart risk. These patches form when fatty deposits of cholesterol gather under the skin, usually near the inner corners of the upper eyelids. While they are painless, they are not harmless. Studies from the American Heart Association show that people with xanthelasma are significantly more likely to develop heart disease or stroke even when their blood cholesterol levels appear normal. That is because these yellow marks often reflect an underlying imbalance in lipid metabolism and silent buildup of plaque in the arteries. Imagine a woman in her 50s who notices small yellow spots near her eyes and covers them with makeup. She thinks it is just age or sun exposure. Months later, her doctor finds her triglycerides are high and her arteries show early blockage. If she had known that her skin was warning her, she could have acted sooner. If you notice xanthelasma, get a lipid panel test right away and review your diet. Reducing saturated fats, eating more fiber, and walking daily can lower your risk dramatically. Your skin often reveals what blood tests confirm, but even if your eyes look clear, another subtle ring forming inside them might be signaling an even greater concern for your heart. Number 4. Arcus senilis. Sometimes when you look closely in the mirror, you might notice a light gray or white ring forming around the colored part of your eye. Most people ignore it, thinking it is just a natural part of aging. But this subtle halo called arcus senilis can quietly point to cholesterol buildup and future heart trouble. It appears when tiny fat particles settle at the edge of the cornea, creating that cloudy ring. While it is common in older adults, doctors warn that if arcus senilis shows up before the age of 40, it could signal dangerously high cholesterol levels or a genetic lipid disorder. Research from the American Journal of Ophthalmology has shown that people who develop this sign early are at a much higher risk of heart disease, even if they feel perfectly healthy. Picture a man in his late 30s who notices his dark brown eyes turning lighter near the edges. He assumes it is a trick of light, but his body is trying to speak. Later routine tests reveal cholesterol far above normal. That faint ring had been his first warning. If you see arcus senilis, do not panic, but do not ignore it either. Ask your doctor to check your lipid profile and maintain a heart-friendly lifestyle rich in vegetables, olive oil, and omega-3 fats. The eyes truly are windows to the heart. Yet the next change you may notice is not in your eyes at all, but in the color of your skin, and it can appear suddenly when oxygen runs dangerously low. Number 5. Cyanosis. Have you ever noticed your lips, fingertips, or toes looking slightly bluish, even when the weather is warm? It might seem harmless, but this color change called cyanosis can be one of the body's most urgent warning signs that your blood is not carrying enough oxygen. When your heart cannot pump effectively or when the arteries are blocked, the oxygen that should reach your skin and organs decreases, turning parts of your body a pale or purplish blue. Doctors often see cyanosis in patients with heart failure, severe valve disease, or blocked coronary arteries, but it can also appear in lung conditions that make oxygen exchange harder. The key difference is that when your skin turns blue in warmth, not in cold, it usually means your heart or lungs are struggling. Imagine an elderly man sitting on his porch in Florida sunshine. He feels fine, but his wife notices his fingertips are blue and his lips look dusky. Thinking it is nothing, they ignore it. Days later, he ends up in the hospital with fluid buildup from heart failure. If you ever see this symptom, do not wait. Check your oxygen levels, see your doctor, and ask for an echocardiogram. Your skin is speaking for your heart, but this is not the only external clue your body gives, because sometimes the heart struggle appears as open wounds that refuse to heal. Number 6. Leg or foot ulcers. When a small cut or sore on your leg refuses to heal, it might be more than just a skin problem. Chronic leg or foot ulcers can be one of the clearest visible warnings that your blood is not flowing properly and your heart may be under stress. These wounds develop when arteries that carry oxygen-rich blood become narrowed or blocked, starving the skin and tissues of the nutrients they need to repair. Doctors call this arterial insufficiency, and it often appears in people with diabetes, high cholesterol, or long-term smoking history. The result is slow-healing ulcers that may appear on the toes, heels, or outer parts of the legs. They are usually painful, cold to the touch, and bleed very little. Imagine a retired teacher who notices a small sore on her ankle that lingers for weeks. She tries creams and bandages, but it never improves. When she finally visits her doctor, tests reveal poor circulation from plaque buildup in her arteries. That tiny wound was her heart's cry for help. If you notice a wound that takes longer than 2 weeks to heal, do not ignore it. Get your blood flow checked through a Doppler ultrasound and manage your blood sugar and cholesterol levels. Your skin can reveal what your arteries hide. But even if your skin looks fine, swelling deep inside your legs might be silently signaling the next stage of heart strain. Number 7, swelling in the legs and ankles. By the end of the day, do your shoes feel tighter or your socks leave deep marks on your skin? Many people brush this off as normal aging or standing too long, but persistent swelling in the legs, ankles, or feet is often the body's way of revealing a struggling heart. This swelling, called edema, happens when the heart cannot pump blood efficiently, causing fluid to build up in the lower parts of the body. Gravity pulls the excess fluid down, making your ankles puffier as the day goes on. Doctors at the Mayo Clinic explain that this kind of swelling is a classic early sign of heart failure or a weakened heart muscle, especially when it worsens in the evening and improves after resting with your legs raised. Picture a woman in her 70s who notices her sneakers no longer fit by evening. She thinks she just needs bigger shoes, but her body is whispering something deeper. Weeks later, she feels short of breath and exhausted. Her doctor confirms that her heart is not pumping as strongly as before. If you experience this kind of swelling, do not ignore it. Check your salt intake, stay active, and talk to your doctor about fluid retention tests. Your legs often show what your heart cannot say. But seeing the signs is only half the story, because now it is time to understand the 7 hidden symptoms you can feel inside before a major heart event occurs. You have just learned the 7 visible signs your body shows when the heart begins to struggle, but what happens inside is just as revealing. The truth is, your body doesn't only speak through what you see, it also whispers through what you feel. Many people experience subtle sensations long before any diagnosis, shortness of breath, fatigue, or strange pressure in the chest, yet they dismiss them as stress or aging. In the next part, you will discover the 7 internal symptoms that your heart uses to warn you from within before it is too late. Number 1, shortness of breath. Have you ever climbed a flight of stairs or walked across a parking lot and felt more breathless than usual? Most people think it is just age or being out of shape. But unexplained shortness of breath can be one of the earliest signs that your heart is not pumping enough blood. When the heart weakens, it struggles to deliver oxygen to the body. The lungs then try to compensate, forcing you to breathe faster, even during light activity. Doctors at the Cleveland Clinic explain that this happens because fluid begins to back up into the lungs, a condition known as pulmonary congestion. The result is a feeling that you cannot take a full breath or that air is never enough. Imagine a retired man walking his dog each morning. He used to enjoy the stroll, but lately he has to stop halfway, gasping for air. He blames the weather, but his heart is trying to speak. After a checkup, his doctor confirms early heart failure. That small shortness of breath was his first warning. If this happens to you, do not ignore it. Track when it occurs, avoid lying flat right after meals, and schedule a cardiac evaluation. Breathing should feel effortless, not like a chore. But shortness of breath is only the beginning, because sometimes your body releases another signal, a persistent cough, that quietly reveals fluid building inside your lungs. Number 2, persistent cough. A cough that refuses to go away can easily be mistaken for allergies, asthma, or even a lingering cold. But a soft, persistent cough that produces white or pink frothy mucus can be a hidden sign of heart failure. When your heart grows too weak to pump blood efficiently, pressure builds up in the blood vessels of the lungs. This pressure forces fluid to leak into the tiny air sacs, causing irritation and that constant need to cough. Doctors at Johns Hopkins note that this type of cough often worsens when lying down because more fluid shifts toward the chest, making it harder to breathe at night. Imagine a woman in her 60s who coughs every evening while watching TV. She takes cough medicine thinking it is seasonal, but nothing changes. One night she wakes up breathless, surrounded by pillows, struggling for air. At the hospital, her doctor tells her the truth: her heart is retaining fluid. If you have a cough that lingers for weeks and comes with shortness of breath or swelling in your legs, do not ignore it. Reduce salt intake, avoid smoking, and see a cardiologist. Your cough may not be from your throat, but from your heart trying to clear its own burden. Yet this is not the only signal that grows stronger when you lie down, because your breathing itself may reveal the next stage of hidden heart distress. Number 3, shortness of breath. When lying down. Have you ever noticed that the moment you lie down, your breathing becomes heavier or uncomfortable, forcing you to add extra pillows or even sleep sitting up? This condition, known as orthonia, often signals that the heart is too weak to handle blood, returning from the lower body when you rest. As you recline, gravity no longer pulls blood toward your legs, so the extra volume flows back to the lungs. If the heart cannot keep up, fluid begins to accumulate in the air spaces, making each breath feel like a struggle. Doctors from the American Heart Association warn that this symptom often appears before full-blown heart failure, making it one of the most critical signs to notice early. Picture an elderly man who once slept soundly on his back, but now stacks 3 pillows just to get through the night. Sometimes he wakes up gasping for air sitting on the edge of the bed, feeling his chest tighten. This sudden awakening, called paroxysmal nocturnal dyspnea, is his heart's way of asking for help. If this happens to you, take it seriously. Avoid eating large meals before bedtime, limit fluids in the evening, and schedule a cardiac exam. Rest should restore your energy, not steal your breath. But sometimes, even when breathing feels fine, your body's weakness during the day may reveal another quiet symptom of heart strain. Number 4, constant fatigue and weakness. Do you ever feel drained even after a full night of rest? When climbing stairs or carrying groceries suddenly feels like running a marathon, your heart might be sending a message. Constant fatigue and weakness are among the most overlooked early symptoms of heart disease. The heart's main job is to pump oxygen-rich blood to every cell in your body. When it begins to fail, less oxygen reaches the muscles and organs, forcing your body to slow down to conserve energy. Doctors from the Mayo Clinic note that this type of tiredness is not mental exhaustion, but physical depletion, often accompanied by dizziness or shortness of breath. Think of a woman in her late 50s who used to love gardening. Lately, she finds herself needing to sit down after only a few minutes of planting. She blames the summer heat, but her heart is struggling to deliver enough blood to her muscles. A routine exam later reveals early heart failure. If you feel this deep, persistent tiredness, do not push through it or ignore it. Keep track of when it happens, stay hydrated, and consult your doctor for an evaluation. True energy begins with a strong heart, not more caffeine. But fatigue is only one clue, because sometimes your body's nightly routine, waking up often to use the bathroom, can uncover the next hidden sign of a weak heart. Number 5, frequent nighttime urination. If you find yourself waking up several times each night to use the bathroom, it might not just be aging or drinking too much water before bed. Frequent nighttime urination, known as nocturia, can be an early and overlooked sign of heart failure. When your heart struggles to pump blood efficiently during the day, fluid builds up in the legs and ankles. As soon as you lie down, gravity shifts this retained fluid back into the bloodstream. The kidneys then try to remove the excess by producing more urine, which is why you may wake up repeatedly at night. Doctors from the National Heart, Lung, and Blood Institute explain that this nighttime fluid shift is one of the clearest signs that the heart's pumping ability is weakening. Picture an older man who spends every night getting up 2 or 3 times, believing it is just part of aging, but his swollen ankles and fatigue tell a different story. After visiting his doctor, he learns that his heart is working harder than ever just to keep up. If you notice this pattern, reduce sodium intake, elevate your legs before bed, and discuss the symptom with your physician. Sleep should renew your body, not become a restless cycle of bathroom trips. But the next signal is not about rest at all. It strikes when you are moving and your legs begin to ache with every step you take. Number 6, leg pain. While walking. Have you ever started walking and felt a dull ache or tightness in your calves that eases the moment you stop to rest? Many people call it muscle fatigue, but this condition, known as intermittent claudication, can be an early sign that your arteries are narrowing and your heart is under pressure. When cholesterol plaque builds up inside the arteries that carry blood to your legs, oxygen cannot reach your muscles during activity. The pain fades with rest because the demand for oxygen drops, but it always returns when you walk again. Cardiologists at Harvard Health explain that this type of pain often signals peripheral artery disease, which nearly doubles the risk of heart attack and stroke. Imagine a woman in her 60s who enjoys walking with her grandchildren. She notices her legs cramp halfway through the park, but feels fine once she sits down. Weeks later, she learns that poor circulation is limiting her blood flow, not only in her legs but also in her heart. If you experience this recurring pain, take action immediately. Stop smoking, stay active, but avoid overexertion, and talk to your doctor about an ankle brachial index test to check blood flow. Your legs are mirrors of your arteries. But sometimes the most alarming sign of all comes straight from your chest, a feeling so intense that it can never be ignored. Number 7, chest pain or pressure. When your heart is in distress, it rarely stays silent. Chest pain or pressure is the body's loudest alarm signaling that the heart muscle is not receiving enough oxygen. This pain can feel like heaviness, squeezing, burning, or tightness in the center of your chest. Some describe it as if an elephant is sitting on them. It may radiate to your left arm, neck, back, or even jaw. Doctors from the American College of Cardiology warn that this kind of discomfort, especially during exertion or stress, is a hallmark of angina or a potential heart attack. The reason is simple: when arteries supplying the heart are narrowed or blocked, the muscle suffocates and pain becomes its cry for help. Imagine a retired man mowing his lawn on a warm afternoon. He feels a dull pressure in his chest and assumes it is just the heat. Minutes later, the pain spreads to his arm and sweat pours down his face. At the hospital, doctors confirm a blocked artery. That short delay nearly cost him his life. If you ever feel chest pain that lasts more than a few minutes, do not wait. Call emergency services immediately. Acting within the first hour can save the heart muscle and your future. But even after learning all these warning signs and symptoms, protecting your heart does not end here, because prevention is the key that keeps every heartbeat strong. Your heart has been speaking to you all along, through every breath, every step, and every small change in your body. Now that you understand these signs and symptoms, you hold the power to protect your most vital organ. The truth is, simple awareness saves lives. No one can control time, but everyone can control their choices. Start today. Eat more heart-friendly foods like fresh vegetables, olive oil, berries, and salmon. Move your body every day, even if it is just a short walk. Get regular checkups, monitor your blood pressure and cholesterol, and listen to what your body tries to tell you before it is too late. Your heart wants to heal, it just needs your help. It responds to kindness, to care, and to consistency. Never ignore small symptoms or assume they are part of aging. The body is always whispering clues, and those who pay attention can prevent the tragedies that statistics warn about. Every heartbeat is a second chance, and no matter your age, you can always strengthen and protect your heart starting today. If this video has helped you understand your body better, share it with someone you care about. Save this video so you can return to it anytime and learn more. And before you go, remember to subscribe to our channel. You will receive the latest medical knowledge and senior health tips designed to keep your body strong, your mind sharp, and your heart beating with hope. In our next video, we will explore the everyday foods that naturally strengthen your arteries and restore blood flow. Stay informed, stay active, and take care of your heart, because a healthy heart is the foundation of a longer, happier life.